For more on this, I'm joined by Dr. Joel Selanikio. You spoke earlier to Mike Walter, and we have a different bit of a twist. We want to take this as more of the sort of economic impact. But let me start with what Bianca was talking about earlier, the air travel, this discussion that we're lightly having. And look, let's be honest, it's controversial because we're basically discriminating against people from certain countries. Is this a good idea to even begin down this path?
Well, I think we have to have some screening, Phil. I think it would be foolish to shut down air travel completely between these countries because we're not going to be able to stop this epidemic unless we can get people to those countries. And of course, people want to rotate back. So we have to keep air travel going between, for example, the U.S. and Liberia to get supplies in, to get personnel in and out. So there's really no question that we could shut down the border completely or that it would be a good idea for us.
You used to work for the CDC,
yeah,
and you're also a medical professional at Georgetown University, and you're watching all of this occur, from your chair. You must think of ways that they could have done better, don't you?
Well, I think it's easy to second guess, and people are doing a pretty good job already. But at the same time, certainly right now I run a company called Magpi. We make software that's used to do things like contact tracking, but to use mobile phones instead of collecting data on paper. I mean, obviously, doing anything on paper for this kind of an epidemic at this kind of scale would probably be a mistake. Unfortunately, that's kind of the dominant approach. So I think we could probably computerize a little bit of what was going on and speed up the process.
Are you insinuating that the tracking of these patients and the tracking of who may or may not be contacted by this, that's not being done, I guess, to the level of standard that you'd like to see?
Well, it's being done according to the standard of care. The standard of care in this case is to collect information on paper. But of course, we have computers now. And what's even more interesting, people in Liberia and Sierra Leone are walking around with phones connected to the internet. So there's a lot of data that could be collected, a lot of reporting, contact tracking, supply chain management, lab reporting, all sorts of stuff that could be done electronically because we have the internet and we have these phones in place, but really isn't being done. And this is, I think, one of the things that we're trying to make a dent in.
Now, we've got this first case here in Dallas, and
right.
There's a lot of rumors of other cases around the area. I'm going to set that aside for just a moment here. The technology that you're talking about, how would that help ease some of the concerns? How would that help with the situation?
Well, for example, with contact tracking, this is a side of health, I think, that people usually don't see. Everyone understands that if someone has Ebola, for example, the fellow in Dallas, they understand the clinical side, that this man needs to be treated. But for many people, this is the first time they're hearing about things like contact tracing, that we need to go out and basically identify anyone who could have come into contact. And it's not like when, for example, the police are doing a similar kind of detective work on a television show where they're just writing down a couple notes.
What's contact? What does that mean? You and I shaking hands, you and I having a cup of coffee. What does suspected or contact mean? Where does the risk start and where does it end?
Right. Well, as you know, and we talked about, Ebola is not an airborne disease, right? So to get Ebola is actually pretty difficult. So people we're considering as contacts are people who had close contact with Ebola patients. For the fellow that's in Dallas, of course, this is anybody that was, living in the same house, for example. It's not people that this guy passed on the street. And so, that's, if anything, if there's anything good about this, it's the fact that Ebola is not an airborne disease.
Well, I was going to say, because the reports are the people he shared the house with, that he was at, there are other individuals at that house, they have thus far not shown any symptoms yet of Ebola. And you would think if I'm living in the house with you, then there'd be a very high probability that I would be infected, or you would be infected, right?
Could be up to 3 weeks before they show symptoms. So they're not out of the woods yet.
Okay. Speaking of that, this outbreak that we're watching, a lot of people are worried this is going to go well into next year. Your professional opinion, how concerned should we be that this ends up being a problem in 2015?
Oh, I don't think there's any question that this will extend into 2015. I think that we're on the road to getting this under control in West Africa. Again, in the United States, it's under control. CDC, I think, is doing a good job.
You're not worried at all about the United States?
I am not at all worried about the United States. I think we could have a case, we could have 2 cases, we could have
Spain,
5 cases.
Europe?
Same thing for Spain. They have the resources to fight this problem, to do the contact tracking and the treatment. West Africa doesn't, and right now we're bringing those resources in. So again, I think there's absolutely no question. Anyone who says we're going to wrap this up by Christmas is, I don't think anybody would say that at all.
Before I go, what's the one thing that you're looking for to say, look, we're on the right side of this, we're on the other side, this is getting resolved?
Well, I think the biggest thing that's going on is that we're awake now, right? I mean, look what happened in Dallas. A fellow shows up and says, I'm feverish and I came from Liberia. He gets sent away from the hospital.
Oh, that's a whole nother issue.
But that's
a lot of people are
less
saying
likely to happen now.
the hospital dropped the ball on that. Doctor, thank you very much for helping dispel some of the myths